In 1992, I was engaged to be married, and I was a few months away from getting married when my fiancé was killed. And I remember that it was at that time I really didn't know how I was going to make sense of that. I didn't know how I was going to recuperate. I didn't know how I was going to be able to exist. I really had to take that pain and not only ask God for healing, but allow that pain, that story of healing, to help me to move towards, I call it healing in motion. You know, life had to continue, but I was in a rehabilitation process as I lived and as I learned how to build new relationships with people. It was at that time that Adventist Health was having a training for the chaplains in the Central Valley that I came to know about Creation Health. So I was being trained with about 30 other pastors and leaders in the community. And so I heard the first, few sentences about what Creation Health was about, and I was captivated because it described to me what my journey of healing in motion meant. It was that every day I had to make a choice. It was that every day I had to look at moments for rest of my heart. I had to look at the environment. I had to be very intentional about the activities I did. I mean, I literally was finding out that someone was speaking about what I was doing for the last 20 years of my life. So I was captivated by that material, and I was captivated by the principles. It just felt like it had a language to it I was doing. And I wanted everyone to know about it. At that time, I wasn't employed. I was still searching for a job. And I didn't understand God's plans, and His plans are greater than mine, obviously. But I was so thankful that He allowed me to have the opportunity to apply for the school-based health center. It wasn't until I was in this role for about 8 months that I began to work with the parent education group in the school district. And we were trying to find a way that would link the parents to the clinic. And I remembered about Creation Health. And I thought, why don't we connect the parents in this 8-week classroom setting and link them to the school-based health center? So I was thankful that I was able to bring it to the Director of Student Services, and she agreed. I brought it to the Jefferson Clinic, and they agreed. And so we had our first class 2 years ago, and it was fantastic. The ladies totally embraced it. They loved it. And it also awoke in them something they had been searching for. It gave them a language to something that they were trying to do every day.
Well, 16 years ago, we started with maybe 20 mothers. And at that time, when we started, the idea came from Mrs. Carouso. She was our principal, and it was her vision. This was one of her visions to see this happen. When the idea of a health clinic came about, she asked me and one of the school nurses, and we went to go visit one in Fresno. It was in Clovis, to see how that worked. And we just were excited about it, and we said, no, we need to bring this to Jefferson School.
In 2007, I actually left this square block, city block, and went to the district office. Really, one of my major goals that I made clear in applying to move to the district office was about getting this health center in this community on this campus.
The intent was to have the clinic on the school grounds, but we serve everybody. And that's the beauty of placing it here in this area of the community. It provides access to care that just wasn't here.
You're important. When you're healthy, then your family's going to be healthy. So we're going to help you become healthier. So in turn, your family will become healthier, and then our community will become healthier. So because it's through them, that interaction, that they help each other. With the neighbors, so they're good role models. Then they become good role models not only for that, but for their English, that their kids are seeing them coming to school.
Most definitely, I have sat in on the creation classes, and the energy is electric. Miriam teaches the classes and basically goes asking the questions, and really is focused on the parents' needs. And then after the parents' needs are met with healthy and just going through the whole process, they internalize it and then are able to take it home and branch it into their own families and their children.
Oh, I learned so much. Number one, how to acknowledge that me as a full-time mom, as a full-time employer for Adventist Health, I need to always take a step back and remember that I'm important as well, to be able to adjust my lifestyle. It's been very life-changing for me. I've learned how to eat differently, which I've been doing already for a couple weeks. I've lost 9 pounds, and this class just motivated me. It motivated me, motivating my family to do it as a team.
Siempre estoy diciendo, yo asisto a Creación Salud, es bien bonito y allí nos tratamos como familia y te hace sentir bien y tú sientes esa paz, esa tranquilidad y andamos corriendo la voz para que la gente venga y esté con nosotros. Es muy bonita la clase.
And so I'm really excited that I get to be a part of this. And I'm really thankful that every day is a gift. I look forward to coming to work every day. I don't really feel like it's work. It's more like missionary work. It's more like ministry. I don't know what God's going to bring in through the door every day or who He's going to bring in through the door. But I'm excited because I know that every piece of the puzzle already makes sense to God. He is the master designer and He sees the bigger picture. And so I have the opportunity to just be a part of His bigger vision and His bigger dream.